welcome to day 3 of our 7-day training. I will begin our training today a little bit unusual than what I've been doing so far, because I have noticed some things that really is concerning me, because I have noticed on some of my videos on the comment section and also in our Telegram group, I have seen that there are some scammers out there that they are doing what they do best, which is stealing money from people. They're sending messages to the students, to the nursing students, saying that they belong to NCLEX Crusade International, asking for money to be sent via Zelle or bank wire or a gift card or whatever. I want to make this clear. From day one, I said that this was going to be a free training, and it is. I am not charging any one of you for this training. You do not have to pay me. So if somebody is trying to say that they belong to the academy, asking you for money, please delete them, block them, and under no circumstance you are going to send them any money. They're trying to steal money from you. It is really sad. It gets me very upset to see the extent of how people can be so evil. And I'll tell you this, I prefer to be broke than to lose my values and morals. So it really gets me sad, but oh well, it is what it is. Evil exists and is going to continue to exist. But we have to do the best we can not to fall under these scams. So I apologize in advance if anybody has contacted you from the academy asking for money. Once again, do not send anybody money. Whenever it comes, when the time comes, at the end of our training, I will say I might be doing some Zoom classes or something like that. I'm still thinking about it because, like I told you, I am very busy with the Spanish NCLEX Academy, and I don't have a lot of free time. But I've gotten so many messages from you guys asking for help, asking me to help you guys. And although I'm doing this 7-day training, my future plans is to continue doing other trainings on other topics. But I will also, in the near future, maybe do some like small group Zoom classes, maybe to practice questions together or something like that. When the time comes, I will send a video with me on it, and I will use my website for any type of payment. But do not worry about that now. The purpose of this training is not to sell you on something. The purpose of this training is to help you. The purpose of this training is to guide you. I am Christian. I believe in God. I do not steal money from anybody, and I want that to be clear. With that said, okay, let's move on to for the real reason that we are here, which is NCLEX training. Thank you, Vivi Tobar. Thank you for your donation to our YouTube channel. I appreciate your support. Thank you very much. All right, so I can't believe it. We are already on day 3. Day 3 of our 7-day training. First day, we talked about understanding the NCLEX world. On day 2, we talked about NCLEX categories. And today, day 3, we're going to talk about other NCLEX categories that we did not discuss yesterday. Now, if you are listening to this live YouTube, or you're watching this video later on replay, and you have not seen day 1 and day 2, please stop the video or stop watching whatever you're watching and go back to day 1 and day 2 so it makes sense to you. Because if you do it out of order, you could be a little bit lost, okay? Thank you, Mr. Jorge Martinez, for your donation and support to our YouTube channel. All right. All right, here's our day 3 agenda. This is the topics that we're going to discuss and cover today. How to master safe and effective care environment NCLEX style questions. So we're gonna focus on first management of care, NCLEX style questions, and safety and infection control NCLEX style questions. So I hope that you do enjoy our day 3 of our 7-day NCLEX training. Remember yesterday I talked about the distribution of content for the NCLEX RN test plan. And as you can see, we talked about the different categories, and the focus today is going to be safe and effective care environment that is subdivided into management of care and infection control. But we're going to talk about that in just a few minutes. Let's begin. Safe and effective care environment. In order to show the NCLEX that you are a safe and effective nurse when it comes to the category safe and effective care environment, the nurse shows the ability to promote achievement of client outcomes by providing and directing nursing care that enhances the care delivery setting to protect both clients and healthcare personnel. When we talk about safe and effective care environment, there are 2 subcategories. Management of care that represents 17 to 23% of the questions that you will encounter on the NCLEX, and safety and infection control that represents 9 to 15% of the questions that you will encounter in the NCLEX. Now, when we talk about management of care, there are different topics that are included in management of care. I got this information from the NCSBN test plan. I will ask my advisor that is here monitoring this live to share on the comment section the link to have access to NCSBN test plan. That way you can see everything that I'm seeing. That way you can get this information directly from them. Like I said, I did not make this up. This is strictly from NCSBN and the NCLEX. Thank you, Alexandra Hippolyte, for the support and donation to our YouTube channel. Thank you for that super sticker. I appreciate it. God bless you. All right, so what is included? What are the subtopics in management of care? Advanced directives, so a lot of ethics and laws in management of care. Delegation, supervision, and some prioritization in management of care. Practice and advocate for cost-effective care. Providing education to clients about rights and responsibilities. Advocation for client rights. Collaboration with the interprofessional team members when providing client care. Managing conflict among clients. Maintaining clients' confidentiality and privacy, and a lot more. So what should you do with this information? Let's say that you went to the NCLEX. Let's say you took the NCLEX and you failed. And it says that you're weak in management of care. You are below the passing standard in management of care. So what should you do? Review this test plan and find out the topics that are included in that category and start doing 2 things. Number 1, reviewing that information, and number 2, practicing questions every day on those topics that you are below or near the passing standard. If you have never taken the NCLEX before, well, you have to study everything. You have to focus on everything. And I want to start this afternoon, this evening, with the right foot. Let's start practicing some questions together. And this first question is very, very interesting and is a place in order style questions. So all the answers apply. You have to identify what is the correct order and put the answers in the correct order. So what I want you to do on the chat section, I want you to comment your answers in what order. So you're going to give me 5 answers, and it has to be in the correct order. Thank you, Ms. Yuseline, for your donation to our YouTube channel. Thank you for your support. I appreciate it. And also, Ms. Denia Sanchez, thank you for your donation and support to our YouTube channel. So let's review this question together. It says, the nurse is notifying the healthcare provider via telephone of a change in condition of a client diagnosed with exacerbation of asthma. So you already know about the 5 key factors of an NCLEX question. If you do not know what I'm talking about, go back to day 1 and review that video where I teach the 5 key factors of an NCLEX question. So the purpose of this question is about reporting and talks about a client that his condition changed and now has exacerbation of asthma. It says, arrange the nursing statement in order as they will be communicated using the SBAR method. In other words, to answer this question correctly, you have to know what SBAR represents. If you do not know what SBAR represents, then it's going to be extremely difficult for you to answer this question correctly. So if you don't know what SBAR is, do not worry. I will share with you what is SBAR and how SBAR is used in communication with the healthcare provider. So we have several answers, and I'm going to teach you a technique, okay? I'm going to teach you a strategy that I use with questions that I have to put in order, or answers that I have to put in order. The first thing that I do is I read all the answers. I do not try to put them in order yet. I read every answer and try to understand what each answer is saying. And then I try to identify what I think is the first and last answer. And then I start using some critical thinking as well. So before we go into that, let me explain to you what the SBAR method is. Thank you, Ms. Fonseca, for supporting our YouTube channel. Thank you, Maftuna Alimova, for donating and supporting our YouTube channel. I appreciate it. All right. So what is SBAR? What does it stand for? SBAR represents situation, background, assessment, and recommendation. What that means is when you have a patient that something is going on to the patient's condition change, and you are going to call the healthcare provider and report this change in condition, you have to do it in a certain order. You cannot just say, hey doctor, my patient is not breathing correctly, I need some medication. It doesn't work like that. That is not the proper way of communicating with the doctor. So first, you have to explain to the doctor what is the situation, what is going on. Then talk about the background. Who is the patient and why is the patient there? Then you're going to talk about the assessment that you did as a nurse and the information that you got from that assessment. And lastly, you're going to talk about recommendation. Hey, doctor, what do you think? Can we do this? Can we do that? You interact with the doctor. Because if you are a real nurse, if you are a safe and effective nurse, you're not a secretary. You have to use your critical thinking, and you can provide feedback to the doctor. If the doctor tells you something that you think is wrong, you can tell the doctor, doctor, I don't think that's right. Did you understood what is going on? Are you sure that's the medication you want me to administer? And that is part of safety and medication safety. But you have to understand that it is an interaction, a communication between you and the doctor. So as we review these answers, what do you think is the first answer choice? What do you think is the first action that you would do? And I see a lot of you answering number 3. Which means you call the doctor, and the moment the doctor picks up the phone, you say, hello, hi doctor, my name is Nurse Ray from Unit D of XYZ Hospital. This is who I am. Because the doctor needs to know who is calling him or her. So I agree that answer number 3 is the correct first answer, or the first option to do. Now, what do you think is the last option? If you remember SBAR, you know that the R at the end represents recommendation. And you see right in the answers, answer number 4 says, I recommend that we increase his oxygen dose and prescribe an extra albuterol treatment. So I agree with you guys. Answer number 4 looks like a good last answer. And what I like to do, I start taking this off the screen. 3 and 4, gone. So what is the following action after I call the doctor and say, hey doc, my name is Nurse Ray from Unit D? Then you're gonna talk about what? The situation. What is going on? The reason of my call. The reason I picked up the phone and dialed your phone number is to notify you because my patient, Bob Smith, has become increasingly more short of breath with audible wheezing this afternoon. So answer number 5 talks about the situation. What is going on with the patient? So I can eliminate answer number 5. I saw a lot of you selected answer 2 next. So before I talk about the background, I have to talk about the situation now, the reason of my call. Because otherwise the doctor is going to say, why are you telling me all this? What is going on now? Because the patient's situation now takes priority. So doctor, the problem now is that the patient is having more difficulty breathing and audible wheezing. That is the situation now. And then I'm going to talk about the background. See, Dr. Smith, the patient was admitted yesterday with exacerbation of asthma. He typically controls his asthma with oral medication and inhalers at home. He is ordered albuterol treatments twice daily, and oxygen is prescribed at 2 liters. So that is the background. So answer number 2 Done. And then, what goes after situation, background? Now you talk about the assessment. Okay, this is what I found. This is my assessment part. The patient's respirations are now 32 breaths per minute. The O2 saturation is 89%. The lungs reveal wheezing in all lung fields. And there's slight nasal flaring that is noted. So then answer 1 will be the next right answer. So the correct order will be 3, 5, 2, 1, 4. That is the correct order, as you can see on the screen. So if you made a mistake, once you see the replay, go back to this question and think about it. What was the mistake that you made and how you can do it better? That is what you are supposed to do. When you're practicing with question banks and you make a mistake, don't leave it there as a mistake. Go back and say, what did I do wrong and how can I make it better? How can I improve in this area? So thank you to everyone that answered the question. Okay? Ms. Alexandra Troncoso, thank you for your support and donation to our YouTube channel. I appreciate it. Thank you, Ms. Marjorie Lewis, for your donation and support to our YouTube channel. All right. Jeanette says, sometimes doctors forget about the patients. Sometimes, yeah, all the time. They have too many patients. They forget. You have to remind them what is going on. Because just a name is not sufficient. Oh, that patient Perez, patient Smith. Okay, I have 5 Smith patients. So you have to remind them where you're calling from and what is the situation. Okay? And then the R is recommendation, which is answer number 4, what we picked as the last option. Remember, we started with an introduction and the last answer choice was 4, which is recommendation. I recommend that we increase his oxygen dose and prescribe an extra albuterol. And then what I like to do before I hit next, I read everything again and I see if it makes sense. Okay, so first I call the doctor, I tell the doctor who I am. Okay, that makes sense. Then I tell the doctor the reason of why I'm calling. Okay, that makes sense. Then I tell him the background, when was the patient admitted and what was happening with the patient at that time. And then I tell him, the doctor, about the assessment that I just completed. And lastly, I tell him about recommendations that I think could be helpful. Okay? SBAR represents situation, background, assessment, and recommendation. Correct. All right. Thank you. Thank you for the support. I appreciate it. All right, let's go to the next question. And this is the type of question you see frequently on management of care. So read the question, think about the answer, and most importantly, understand why. If somebody can help me in the chat and type what SBAR represents for the nursing students that are still struggling with that, but do it correctly, okay? So if you can type on the chat, the comment section, what SBAR represents. Situation, background, what else? I'll let you do it, see if you remember. I see Lourdes. Lourdes is doing it there. SBAR, situation, background, assessment, and recommendation. Excellent. Coridi Olabisi is doing it as well. Excellent. All right, so let's go to this question. Which outcome will indicate effective case management? That is an extremely important word or group of words. Effective case management for a child with moderate to severe asthma. So several keywords. Effective case management. My patient is a child and has moderate to severe asthma. So if you're thinking about an effective case management, you are looking for a positive answer. So you are looking for a positive answer, not a negative answer. So as you review each answer, determine, is this a positive or a negative answer? So answer number 1 says, the child attends school regularly with few absences for the year. Wow, that is wonderful. A child that goes to school regularly and has few absences. Well, that is a great, effective example of case management. Because what this represents is that if the management of the patient's problem and medical diagnosis is accurately, I will see good things from the patient. That is what effective case management means. So answer number 1 looks like a possible good answer. That could be the right answer. Thank you, Ms. Jeanette Columbi, for the donation and supporting our YouTube channel. Thank you. So for now, I like answer number 1. That sounds like a good answer. Let's go to answer number 2. The child can tolerate a regular diet without constipation or diarrhea. Awesome. That looks very good. That looks like a positive outcome. However, it has nothing to do with moderate or severe asthma. Has nothing to do. So yes, it's a positive outcome, but it does not make sense to the patient's condition. So answer number 2, I can eliminate. Once again, I am using the process of elimination. Answer number 3, the family does not fill prescription. So here is a negative outcome, a negative response. Does not fill prescriptions. But you may think, well, if the family is not filling the prescription, maybe it's because the patient got better. No. Keep reading. It says prophylactic inhaled steroids. So the word prophylactic means to prevent. So in other words, answer number 3 is a negative outcome, and by doing so, the family is not taking measurements to prevent further complications from asthma. So I can eliminate answer number 3. Answer number 4. The child does not utilize the peak flow meter when cared for at home. This is another negative answer. So what is the right answer, NCLEX Crusader? The right answer is answer number 1. Now, once again, I don't care if you selected the right answer or the wrong answer. To me, it's irrelevant. Okay? What you need to be doing is, did I select the correct answer thinking this way that I'm showing you? Because what I am teaching you is critical thinking. That is what I am teaching you. The thinking process of a question. It is not whether you get it right or wrong. So I see Sarai. Sarai, I don't understand this question, Professor. Great, Sarai. So let me explain a little bit further what this question means. This question talks about the management of a patient that has moderate to severe asthma. As you recall, in nursing school, there's something called a nursing care plan. And within the nursing care plan, there are several things involved. One of them being outcomes that we expect from the patient after nursing interventions are implemented. So, if we're looking for an outcome that shows that the management of this patient's condition was effective, we are looking for an answer that tells me the patient is better. So if you look at the answer, which answer tells me the patient is better? The patient is attending school regularly with fewer absences. So I hope that helps. Now, for example, what could be other possible right answers? For example, not only that the student attends school, what about if it says less hospital readmissions? Or how about going to the doctor regularly for checkups? How about compliance with medications? All of that are indicators of effective case management. Okay? Emerald says, I did not understand either due to the word case management. I thought of a person or case manager. Okay, so I see the difficulty that you had with the question. But understand that effective case management means that nurses and doctors did something good with the management of the case, of the patient's condition, and now the patient is better. So that is what this question is about. All right. Excellent. Oh, we got 415 live nurses here in our YouTube live, and I appreciate all of you guys being here day after day. That tells me that you like and that you are excited about our training. I will be very worried if only one or two students showed up after day 2. Then I will be saying, oh, I did something wrong. Something bad happened. But I am very blessed and humble to be here and to be the one teaching you and helping you. All right? So thanks for that. All right, so we come to the point. Let's like this video. Help me out. I'll tell you this. Because of you guys liking this video and sharing this video with others, 16,000 nursing students saw day 1 live training. That was awesome. Remember, this is a small channel. This is a small YouTube channel. We have about 3,000 nurses. So in comparison with other channels, this is a very small one. So seeing 16 students that we've been able to help, that really gets me very happy and very thankful to God for helping me help you guys. So thank you for liking the videos. Thank you for sharing them with other students. So if you haven't done it yet, go ahead and hit that like button, share it on Facebook, on WhatsApp, and most important, don't forget to subscribe. I have seen many of you that are not subscribed to the channel yet, and you're missing on a lot of good information. For example, I posted a video earlier this morning from one of the questions that we did during the training, and if you were not subscribed, if you didn't hit that bell, then you were not going to receive the notification to see that video. So it is very important for you to do it. I almost started speaking Spanish here. If you see me speaking Spanish instead of English, say, Professor, wrong channel. This is the English channel. All right, guys. Thank you. Thank you very much. So thank you for liking and sharing this video once again. So let's go to safety and infection control. Beautiful articulation, Professor. Follow me well. Thank you. Thank you. But this one is the chosen one. All right. All right. So how do you prove that you are a safe and effective nurse when it comes to the category of safety and infection control? The nurse protects clients and healthcare personnel from health and environmental hazards. Thank you, Benita Vialet, for supporting our channel and donating for our channel. I appreciate it. So here are the subtopics that are included in the safety and infection control. Assessment for allergies, protecting the client from injury, ensuring proper identification, accuracy of treatment orders, participating in emergency response plans, ergonomic principle, education, safety, reporting unsafe practice of healthcare personnel, facilitating appropriate and safe use of equipment, education, and restraints. So a lot of questions about restraints and safe use of equipment. So I want to make sure that you review this because most of the questions on the NCLEX is about that. Now, I have a strategy that I can teach you. I teach this strategy to my students in the Bilingual Academy. They love this strategy. You probably have never seen this strategy before, and I am sharing it with you in this exclusive day 3 of our YouTube NCLEX training. Do you want to know about this strategy? It's an excellent, awesome strategy that will help you answer infection control questions. So if you want to know about this strategy, go ahead and comment. I want to know, Professor. Yes, show that strategy to me right now. Okay, so here it comes. This is the strategy that will help you with infection control question. First step of this strategy. You know that everything begins with the 5 key factors of an NCLEX question. Nothing different with that. We start with 5 key factors of an NCLEX question. Now, step number 2, it is very important. Read it. What is the focus of the question? Is it the patient? Is it the family? Or is it the medical staff? Why this step is important? Because certain questions, the reason why the question was created is to see if you know what you're going to be teaching to the family. But some questions, the focus of the question is about the medical staff or nursing interventions. So the first step to answering an infection control question is to identify who is the target of the question. Is the question about teaching? Who is the teaching for? The patient? The family of the patient, the patient's family? Or is it a medical staff like a UAP, an LPN? So that is an important step. And then step number 3, without this step, you are going to make a lot of mistakes. You have to identify if the focus of the question is to prevent infection, to prevent the transmission of the infection or to treat the infection. Because if the focus of the question is to prevent, then you know that you have to teach a certain action or complete a nursing intervention that helps with the prevention of an infection from appearing. But if the question is about the prevention of transmission, then you know that it probably has to do with transmission-based precaution, standard precaution, hand washing, personal protective equipment. Or if the question is about treating the infection, then it's probably about medical interventions or medication or nursing interventions to treat that specific infection that they are mentioning in the stem of the question. Now, let's see an example of how this strategy works, okay? So let's go to another question. Thank you, Mr. Carlos Alberto. Thank you for your donation, for supporting our YouTube channel. Thank you, sir. One of our NCLEX Crusader. All right, here's the question. Which is most important when teaching a parent about preventing osteomyelitis? So if you use this strategy that I just taught you, let's use the 5 key factors of an NCLEX question. Well, there is a keyword here, most important. The question is about teaching who? Parent about prevention of osteomyelitis. So now you know a lot of information. I need to select an answer that deals with teaching who? The parent. I'm not teaching the child. I'm not teaching another staff member. I am teaching the parent. But what am I teaching? Prevention of osteomyelitis. So look at the answer choices and find an answer where the nurse is teaching the parent about preventing osteomyelitis. So let's review answer by answer. Thank you, Erinea Montero. Thank you for your support to our NCLEX Crusade International YouTube channel. All right, so answer number 1, it says, parents can stop worrying about bone infection once their child reaches school age. Whoa, 1 second here. Yes, it has to do with teaching to the parents, but it says to stop worrying about infection once the child reaches school age. That doesn't make sense. The first thing that I can eliminate this answer, or the first reason of why I can eliminate this answer, is because it does not mention any interventions to prevent infections. So I can eliminate for that reason. Another reason, is it true that after the child gets to a certain age, then the risk of osteomyelitis is not present? That is not true. So answer number 1, gone. If you don't know what osteomyelitis is, maybe you struggle a little bit more to answer this question. Remember that osteomyelitis is a medical term that describes inflammation in a bone. Osteo means bone. Okay? Usually caused by a bacterial infection. So number 1, I can eliminate. Now, let's look at answer number 2. It says, parents need to clean open wounds thoroughly with soap and water. Wow. So first, it's talking to the parent. It's teaching the parent. Good. That's a good point. What is the statement about? Cleaning open wounds with soap and water. Ding, 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 ding. Infection control. If there is an open wound and there is infection, if I clean it with soap and water, it decreases the chances or prevents osteomyelitis. So answer number 2 is a teaching that I can give to the parent that helps prevent osteomyelitis. Now, critical thinking. If an open wound is not cared for correctly, can that turn into a further complication known as osteomyelitis or other complications? Yes. So answer number 2, I like it. I like this answer. It deals with the parent, and it deals with infection control, and it deals with prevention. So answer number 3. Children will always get a fever if they have osteomyelitis. Well, several reasons to eliminate answer number 3. The first thing doesn't mention the parent. The second thing, there is an absolute word always. It doesn't matter what, children will always get a fever when they have osteomyelitis. That is not true. Not every patient manifests the problem the same way. So this is a generalizing statement that is false, but most important, is this answer talking about prevention of osteomyelitis? No. It doesn't talk about prevention of this infection. So answer number 3, I can eliminate it. Answer number 4. I saw some of you selecting answer number 4. And that is very frequent, to confuse in between 2 and 4. So maybe you're reading this question and you were able to eliminate answer number 1. You say, well, that doesn't make sense. Answer number 3, gone. And you're between 2 and 4. What is the right answer? And you're going back and forward. Very frequent in nursing students. When do you know that your critical thinking and prioritization abilities has developed and improved? When you are selecting the correct answer more often when you are in between 2 answers. If you see that you're often in between 2 answers and you are always choosing the incorrect answer choice, then we have some room to improve. So, let's review answer number 4. Children should wear long pants when playing outside because their legs might get scratched. So let's think about this answer. If a child is wearing long pants, is that going to automatically prevent the child from falling, hurting himself, scratching a leg, even through the pants? How do I know this? I have a 3-year-old that she gets a little rough, and even with pants, she gets scratches and injures herself. So answer number 4 is not going to prevent children from getting hurt. First reason. And is that answer choice really going to prevent osteomyelitis? No, it's not going to prevent osteomyelitis. Now, what do you know about infection control that you keep reading and listening to it often and more often? Hand washing, soap and water, personal protective equipment. Do you see any of those fancy words, any of those important words that talks about prevention of infections? Which answer makes more sense to prevent osteomyelitis or an infection? To use soap and water with an open wound, or to tell the parent, to tell the children to use long pants? Does it make sense? The best action is answer number 2. Okay? I see open wounds with soap. Is that okay? Yep, soap and water. Patient gets injured, soap and water to that area to prevent infection. That is okay. It's not a problem. If you read the Saunders book, you're going to see on a lot of these scenarios where using soap and water, it is the correct response. Okay? All right, so the correct answer is answer number 2. All right, let's review another question. And then, the next question, I'm going to teach you another technique to answer infection control questions when the stem of the question is about putting patients together. How do you know what patients can be put together in a semi-private room or a cohort room? So don't miss this next part because it is very important. Ms. Beatriz Delgado, thank you for supporting and donating to our YouTube channel. I appreciate it. Ms. Yadira Castro, that's one of our students. She passed the NCLEX like 2 years ago. She is a nurse practitioner now, and she is on our YouTube live saying hi. And she says, I will never forget that red pen. Also during my test, I used it and was amazing. I have heard this from many students very often, that they can still see that red pen marking important keywords. That is why I use it, so you never forget. Okay? All right. Thank you, Ms. Sirena Rodriguez, for your donation, for supporting our channel. Let's review our next question. Lisette says, I've been there having doubts between 2 possible answers, but you've helped me tremendously to choose the right answer more often. Thank you very much. Thank you, Lisette. Thank you for commenting that. Crystal says, what red pen? Lol. Uh-oh. I see a red pen marking important keywords. I hope you see that, Crystal. Okay, you got it. It's not an actual pen. It's the markings of the pen. Crystal, you're funny. I think you got it now. Anairis Peña, thank you. Thank you for your support, for donating towards our YouTube channel. Thank you for keeping this active. I appreciate it. Very good. So let's go to the next question. Professor, give us the red pen. I'm going to take the red pen to the NCLEX. All right, he says, the charge nurse on the orthopedic unit has 4 semi-private rooms bed available. Which room should the nurse assign to a client being transferred from the post-anesthesia recovery unit following a total knee replacement? So let me tell you the strategy to use here. When in the stem of the question, they're asking you to put two patients together, how do you analyze this scenario and what is the correct answer? You have to think about this. You have two patients, patient A and patient B. So have some imagination here. You have patient A and patient B. This is the key. Patient A cannot hurt patient B, and patient B cannot hurt patient A. So if patient A has a virus and patient B has a bacteria, then we cannot put them together because they have different pathogens, and the virus can hurt the other patient with a bacterial infection and vice versa. Another scenario, if you have a patient with an infectious process, do not put that patient with a patient that does not have an infection. Another scenario, do not mix any patient that is immunocompromised with other patients. Why? You're going to hurt the immunocompromised patient. Remember, immunocompromised patients, they have to be in a private room. So let's use that idea and critical thinking to answer this question. If you know the answer, go ahead and comment your answer and your thinking in the comment section. Milange Noel, thank you for supporting the channel. I appreciate it. Micaela, hi prof, tell me where to send my donation. I don't know how to do it. I know there's a button somewhere that it has the money sign. I think you click on it and it asks you if you want to donate the channel or something like that. I don't know how to do it. Areli is explaining it. Mikael, on the left bottom corner of this chat, there is a $ icon. Click on that and you can make your donation there. Okay. Now I know. Now I can explain. So left corner. Perfect. Miss Sadith, thank you for your donation and the super sticker or super chat. See, I don't even know the difference between the super sticker and the super chat. Maybe somebody can explain it to me. All right. Laura said, Prof, I saw that question in Kaplan or similar to that question in Kaplan. All right, so what patient can we mix together? Remember, the first patient, we have it on the stem of the question. It says, which room should the nurse assign to a client being transferred from the post-anesthesia recovery unit following a total knee replacement? So the first patient that we have, or let's say patient A, let's title this patient patient A, is a post-op patient post total knee replacement. So as you can see, patient A, the one on the stem of the question, does not have an infection. So let's look at our first B patient. So answer number 1. Client in skeletal traction following a fracture of the femur who has, ding, 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 erythema. Erythema at the pin sites. So you have to think, well, erythema at the pin sites could indicate an infection. So now I have patient A and this patient B that could have an infection. So this patient would harm patient A. So answer number 1 is eliminated. Answer number 2. The client with cellulitis and osteomyelitis, we talked about this, following a blunt trauma of the tibia. This is patient C, and patient C harms patient A. So, nope, no cohort. We cannot mix these patients together. Answer number 3. Client with compartment syndrome following a crush injury who is 1 day post fasciotomy. So this patient does not have an infection. But what do we know about fasciotomy? Fasciotomy is a clinical procedure that is indicated for the diagnosis of compartment syndrome. What happens during this procedure, in order to release the pressure, they have to create an incision to that tissue and exposes the patient to infections. So now it is patient A that can harm patient D. So we are going to eliminate this answer choice. Mikael, thank you for a super sticker. Thank you for donating for our YouTube channel. So we have eliminated answer number 1, 2, and 3. We have answer 4. That must be the answer, but let's think about it. So this is going to be my patient E. Client with a long leg cast following an open reduction of a fractured tibia. Okay? Now, these patients both have orthopedic procedures, and an open reduction fractured tibia is not an indication to put the patient in a private room. These two patients can be placed together because A doesn't harm patient E and E doesn't harm patient A. The patient with the fasciotomy, that is an important keyword in answer number 3 to eliminate it. The correct answer is answer number 4. This is an excellent technique, but you have to practice it. When you see a question that deals with infection control and you're putting patients together, think about this. Can patient A harm patient B? Can patient B harm patient A? And if you see that they harm each other, you cannot put them together. Never mix infectious process with a patient with a non-infection, and never mix immunocompromised patient or patients that are on airborne precaution. Remember, airborne precaution, those patients need to be in a private room. All right? Okie dokie. All right, make sure all of you are subscribed to the channel. I say that one more time. You need to be subscribed to the channel to receive notification, activate the bell, and are you ready for our next step? Remember, we have a Telegram group. It's called NCLEX Crusade International 7-day training. It's a Telegram group where I post information, I post videos there, and it's going to be an awesome tool for your NCLEX preparation. In the comment section, my advisor will post the link to join the Telegram group, and it's also on the description of this video. So make sure you click on it and join the Telegram group. And remember, do not send money to anybody there. It doesn't matter if he has my face on it, if he has my phone number. Do not send any money there. Do not fall into that scam. Remember, I talked about that at the beginning of the live. Thank you, Eilis Aronde, for supporting our YouTube channel. Thank you very much. Thank you, Miss Raiza Espinosa, for supporting our channel, for donating for our channel. Thank you. Thank you very much. Areli said, a super sticker is an animated GIF and a super chat is not. That is the difference. Okay. So the one that is animated, that is the best one, I guess. All right. Okay, now I know. You see, you learn something new every day. Advisor, if you can put on the chat, please, the link to the Telegram group so they can join. And also, if you don't find it in the comment section, I will post it after the live in the comment section again. I will pin it so everybody can see it. And also you can see it on the description of the video on YouTube. Are you ready? Are you ready for day 4? We're halfway into our 7-day training. If you're ready for our day 4, come join us tomorrow at 5 p.m. Eastern Standard Time. Same YouTube channel, NCLEX Crusade International. 5 p.m. Eastern Standard Time. Do not miss it for any reason. Tomorrow, we're going to continue talking about NCLEX categories. We will continue to practice questions together. And then, day 5, day 6, and day 7, you cannot miss. Those will be the most important training days of our whole 7-day training. Thank you very much. God bless you all. Thank you for being here, and I wish you the best. I hope that this training helps you prepare for the NCLEX the right way. I hope that you develop your critical thinking day by day. Make sure you go back to the videos and review it again. You don't learn it as fast. You have to hear it over and over. Every time you get into the car, find NCLEX Crusade International. Find a YouTube video and listen to it. Repetition makes you an expert. All right? Thank you very much. God bless you. Bye-bye.